Radiant skin for a good DP, for people need radiant skin for a good DP, for making good reels, for getting good likes. And who else we can have apart from Dr. Jagdish Sakhia? I think laser is now synonym to Sakhia. Wherever you see laser, you see Sakhia clinic. So zip, zap, zoo, any scar, any wrinkle is gone. By the time Dr. Sakhia reaches from the one clinic to the other clinic, wrinkle is gone. So let's hear about the laser.
Thank you, madam, for kind introduction. So, first of all, I am very much thankful to team IMA-CON for giving me this opportunity, specifically Dr. Girish Modi sir and Dr. Vinod sir, Vinesh sir, and entire team. So I'm going to share my 25 years of expertise in laser treatments, variety of lasers. Because nowadays, initially only laser hair removal was there, but nowadays more than 12 different cutting edge technology of the laser. So we'll see where we can use as a solo technology, where we can use a combination with other lasers and with other procedure. So my topic is beyond traditional treatment, unleashing the potential of laser in dermatology. So, okay. So is a general perception of the dermatology branch with medicos. Sir, कोई मरता नहीं और मिटता भी नहीं है. So patient keeps on coming for years, but nowadays with the latest technologies and so many biological injections, we can cure so many untreatable diseases which previously considered as non-treatable. And we have a couple of cases having a mortality like SJ syndrome, toxic epidermolysis necrosis, collagen vascular disease, SLE, pemphigus, bullous disorder. So there are so many casualties in dermatology also. Minimum income by dermatologist was considered, because when I took the admission in dermatology, it was the last person I took in dermatology. But nowadays is the number one choice, specifically in the female, because family life balance in dermatology is very huge. In last 25 years, never came again in the clinic after I closed down the clinic. So it's no emergency, and minimum investment, but it also myth, because nowadays with the high-end gadgets, the investment of the any dermatology clinic, I think more than 1.5 to 2 crore if you are going, if you are taking FD approved machines. And say no charm in this business. Nowadays, last year in BJ Medical College, out of 24 residents, 22 are the females. So you can see that there is too much charm in the dermatology branch. So happiest index in medicine recently, I think dermatology is the second happiest doctor after rheumatologist. And also in the income in the last 22 the data showing that dermatology also has handsome income, more than $4 lakh per year annum. So it's par with other super specialty also. I started my clinic with only investment of 13,000 rupees before 25 years. But now scenario is changed totally. I started my clinic only with radio cautery, wood slam, cryogen, magnification glasses like stethoscope as a physician. So without magnification glass, we cannot see anything. Nowadays with so many visual tools, dermoscopy, trichoscopy, so many, we are using these tools, right? Industrial TCM. Today, I have 26 branches and more than 135 lasers, from CO2 laser to erbium YAG, erbium glass, thulium laser. So we'll see in detail. So now dermatology branch majorly divided in 4 branches, like general dermatology like fungal infection, psoriasis, tinea, like this. Cosmetic dermatology like beautification treatment like microdermabrasion, peels. Aesthetic treatment with anti-aging, botox, filler, threads, laser surgery, all type of lasers, and dermatology surgery like hair transplant, vitiligo surgery, acne scar surgery. So aesthetic procedure comprise botox, filler, peels, microdermabrasion, laser hair removal, fractional CO2 laser, ultra pulse CO2 laser, IPL, tattoo removal, like dermatology surgery, nail surgery, vitiligo surgery, acne scar, mole, wart, cryotherapy, nano fat transfer, sclerotherapy, carboxytherapy, lipoma cyst removal. These are the subspecialty. We can do PhD and we can also develop another specialty, super specialty. It start from dermatopathology to neonatal dermatology. So more than, I think, 24 specialty we can develop in dermatology department. So now we talk about the laser. Our goal is to destroy the primary target like vessels, pigment or hair. Pigment may be exogenous like tattoo or endogenous like melanin. So these are the different type of laser. So you can see 400 to 7, these are the visible spectrum. Human eye can see only this much part. Less than 400 they consider as ultraviolet rays. More than 700 they are considered as infrared. Infrared means microwave, radio, TV wave we cannot see. And less than 400 ultraviolet rays like X-rays, gamma rays, excimer, so we cannot see. So some lasers they are come into ultraviolet spectrum, some are in visible spectrum, and some are in infrared spectrum. So depends on the wavelength. We can target the chromophore. Chromophore is a laser target. Like in kidney stone, the target is stone. In the retina, the target is water. So in like this in dermatology, target is I think vessels, hemoglobin, water, and pigment. So now we see the fractional CO2 laser. Fractional CO2 laser mainly FDA approved indication is acne scar, which were considered as a non-treatable previously. But with help of these gazettes, we can see miracles in mild to very severe acne scar. You can see even in active acne, within 4 to 6 weeks, patient can achieve such type of result. This miracle, because patient come to us with very high hope. This is not possible in the parlor treatment like chemical peels or any medical line of treatment or any just topical cream. Laser will work here, deeper. Pigmentation equals sebaceous hyperplasia, pigmentation, seborrheic melanosis, photoaging like this. Don't now, specifically in female, they don't want to make the skin is an aging process. They don't want any aging process on your skin. So everybody wants to see her skin 10-year younger than original age. So here the lasers and injectable practice combination will work excellently. Here some invasive procedures, some are non-invasive. Here is the fractional CO2 laser under short anesthesia, and you can see the miracle is a patient can expect such type of result. Sebaceous hyperplasia. So in dermatology, more than 5,000 disease, and previously only 5 to 10% disease there can be achievable, treatable. Only infective condition we can treat, like bacterial infection, fungal infection, few viral infection. Rest all autoimmune disease, metabolic disorders, genetic disorders like nevoid condition, they are non-treatable. But now is periorbital hyperpigmentation, because the laxity of the skins, melasma, the pigmentation of the face, female face is very important because they consider as a very severe condition for them. So melasma being a male, we just consider it as a pigmentation, but the female I think is a very dire emergency to treat melasma. Nevoid condition, Becker nevus, non-healing ulcer with help of fractional CO2 laser. These are clinical indication. Traumatic scar with help of fractional CO2 laser and PRP. Keloidal skull post-transplant surgeries. So many patients develop keloid. So here with fractional CO2 laser, laser hair removal and injection triamcinolone and give satisfying result. Acne keloidalis. Keloidal with cryotherapy and fractional CO2 lasers. Post surgery, you can see after ENT surgery, keloid development, intralesional. Post burn surgery, post burn, you can see with help of cryotherapy and fractional CO2 laser. Same patient on the abdomen. Post burn scar is a life changing result with help of various lasers and intralesional injections. Post burn scar. Depigmented and hypertrophic scar with help of excimer and fractional CO2 laser, you can achieve good improvement. Post-burn scar, perioral pigmentation, previously considered a non-treatable condition, but now with vitiligo with combination of excimer, punch grafting and fractional CO2 laser, you can achieve good improvement. Resistant cases, stretch mark, post-steroid application, patient develop a stretch mark with help of fractional CO2 laser. Post chickenpox scar, earliest intervention is best outcome. So start earliest treatment. In old atrophic scar require multiple sessions. Due to obesity and insulin resistance, few patients develop such type of pigmentation in the body fold like neck, underarms and groin regions. So with lifestyle modification, metformin and with laser, patient can achieve good results. 20 nail dystrophy, it's an autoimmune condition. With help of laser, we can injure. Lichen simplex chronic is a scrotal eczema, very resistant to treat. Patients come for more than 10 years, comes and gone. So with help of fractional CO2 laser and intralesion triamcinolone, vulval eczema, patient coming to us, more than 10 years he is suffering from laser. There is leprosy, even after removed from therapy, patient's main concern was this erythema. So with help of fractional CO2 laser, morphia, fungal infection, some patients don't want to take oral medication, or sometimes oral medication is contraindicated. Then with help of lasers and topical creams, nodular prurigo, you can see excellent result with fractional CO2 laser. QC India, some patients don't want tattoo, maybe aesthetic or sometimes religion purpose, so we can remove the tattoo. Nevus opota is a birthmark pigmentation, freckles, extensive freckles on the face, lentigens with help of QC India laser, epidermal nevus, capsular spot, compound melanocytic nevus. These are the non-treatable conditions. With you cannot do any surgery on the nose. So laser is the only solution in such type of patients. Fixed drug reactions, acne rosacea. These patients suffering from vitiligo universalis, means entire body covered with vitiligo, only remnant pigment was there. So we remove this pigment with help of lasers. Lichen planus pigmentous on the face. This only with 2 sessions of the epidermal nevus, patient suffering since birth. So it's a miracle result with the help of laser. Additional pigmentations on the lip, onychomycosis already discussed, eczema, palmoplantar keratoderma, palmoplantar psoriasis and contact allergic dermatitis in palm and so on, very common in household females. So with help of lasers and topical creams, you can achieve excellent results. Palmoplantar pustulosis, localized scleroderma, acne excoriae, patient repeatedly pick up the lesion. So with help of eczema light, granuloma annulare, one type of autoimmune disease, eczema, nodular prurigo, mycosis fungoides, one type of cutaneous lymphoma. You can see excellent result with systemic medications and eczema light. Extragenital lichen sclerosis at atropicans. Alopecia areata, usually intralesional steroid and topical minoxidil will work, but in resistant and recurrence and extensive alopecia, sometimes alopecia totalis or alopecia universalis, here topical cream with eczema light and some mesotherapy and PRP formulation, we can treat such type of, these are marginal alopecia, ophiasis, alopecia totalis. Stretch mark post pregnancy, there was no cure for the stretch mark. Now help of the fractional CO2 laser, microneedling RF we can do. In pediatric psoriasis, we cannot give any methotrexate or any immunosuppressive, where biological injections and eczema light combination give excellent result. Vitiligo on the pediatric patient, we cannot give any immunosuppressive or steroid for prolonged period. Here devices will work. Vitiligo, sometimes there is complication like pigmentary changes, but they are transient and will clear within couple of weeks. Psoriasis, vascular laser. Now we'll see so many hemangiomas, port wine stain, pyogenic granulomas. These are the lesions with help of laser we can remove. Nose, very difficult, patient difficult in the respiration, so just we remove the help of lasers. Periorbital region, lip regions. This is a venous lake on the lip with help of long pulse Nd:YAG laser. Pyogenic granuloma, hemangioma. This is a remnant of hemangioma. Hemangioma resolved by its own. So we remove this part with the CO2 laser. Lymphangioma circumscriptum is a lymphatic anomalies. So with help of CO2 laser we remove capillary hemangioma. Pyogenic granuloma due to repeated trauma on the teeth biting. This is a very iconic patient. More than 20, 30 plastics are denied to do anything on this type of patient. So with help of plastic surgery and lasers and so many devices, we can achieve good result. Patient main ultimate aim is to open the eye, difficult in respiration and difficult in the swallowing. So with help of three lasers, we did this type of result. So with long pulse Indiac lasers, pulse light laser, CO2 laser, radio cautery, cryotherapy and plastic surgery. There is a combination. Now ultra pulse CO2 laser for the acne scar, senile comedones, whiteheads, back, even at the age of 65, some person can develop a senile comedone due to ultraviolet exposure, acne pustulosa, acne, active acne. These are the acne previously considered as not treatable. Now we can see the help of with isotretinoin and topical creams and laser give excellent and ultimate result. Angiofibroma, it is genetic conditions with verruca vulgaris is a viral wart, is a flat wart, is a verruca plana, plantar warts, palmar warts, genital warts. With help of CO2 laser or also you can use cryotherapy. This patient was fired by his owner. It is working in the hotels as a waiter. So owner is fired due to this verruca vulgaris on the palm and so. So we remove with help of cryotherapy and CO2 laser. Molluscum contagium, this is also what? Milia, acrocodon, dermatosa, pupil. These are tiny warts on the face, sebaceous nevus, verrucous epidermal nevus, junctional and compound nevus, actinic keratosis, syringoma, trichoepithelioma. These are the small tiny skin tumor on the face. Mucocele due to repeated ulcer, steatocytoma multiplex is the one type of sebaceous cyst, neurofibromatosis, cone, callosities, keratoacanthoma, porokeratosis, mybelis, keloid. After piercing in this Goldsmith, you can see the development of the keloid. With help of CO2 laser, xanthelasma, there is accumulation of the cholesterol in the eyelid, milia, non-healing ulcer, oral leukopenia. With help of CO2 laser, we can remove this. Ingrowing toenail, very common in adult sports person, ear repairing, vitiligo, laser assisted vitiligo surgery, blepharoplasty with help of CO2 laser. You can do circumcision with the help of CO2 laser. Paraphimosis you can release with CO2 lasers. Frenuloplasty, very simple procedure, only 30-second procedure. You can release this frenulum. And lipoma, basal cell carcinoma, pigmented basal cell carcinoma, squamous cell carcinoma, only on the early stage we cannot do metastasis. Verrucous epidermal nevus, you can see with help of CO2 laser resurfacing. Laser hair removal mainly the face, upper lip, bikini patient coming to us for the cosmetic person, but couple of patient having genetic condition and few have functional deformity, like this is a fontaine nevus, patient is spina bifida, the hair, tufted hair comes from the, so with help of LHR, you can acne keloid release, so many hair inside the keloid, so deroofing the skin with laser, then remove with the LHR. This already discussed. LHR, pylonic patient undergone 8 times surgery. Just we remove the hair to prevent further recurrence. This after post-cancer surgery, skin taken from the chest, you can see the hairy part inside with the laser of hair removal. We can do hidradenitis suppurativa, recurrent boils inside the genital area with help of laser hair removal. Keratosis pilaris, I think very common conditions for the females. Pseudofolliculitis due to ingrown hair, sometimes patient develop this type of the folliculitis. Compound melanocytic nevus, giant melanocytic nevus is a life-changing. Patient still under treatment, require another 5 to 6 sessions, and you can see good output. Previously, these are considered as a non-treatable condition. Acne keloidalis, hairline settings, Earlobe, sometimes patient want to ear reconstruction surgery, so we are doing laser hair removal. Nowadays in vitiligo, we are doing hair transplantation inside the. So after repigmentation, we are going to remove this hair with laser hair removal. There is only no any surgery, no any donor skin taken, only hair transplant done on the vitiligo. Becker nevus with help of lasers. This patient suffering from the scleroderma, there is a fat atrophy, so nanofat transfer with radio frequency tightening, you can see the good output. Some the patient vitiligo, skin grafting with excimer light combinations in pediatric patient. This Gayatri married somewhere else, so now it's become compulsory to remove this Gayatri. So just exercise, give laser during surgery, and this patient applied Betnovate cream on the face for 5 years. There is a thinning of the skin and hypertrichosis, unable to tolerate the sunlight. With a laser, ingrowing toenail already discussed, laser glow. Now patient coming to us for the laser glow, like Navratri, any religious, bridal treatment. Laser glow is the main source of income nowadays for the laser. You can see excellent brightening, lightening effect. Even though in the male, 40% male coming for the facial treatments, for the main glow treatments, seborrheic melanosis, pigmentary changes. You can see ultimate result and long lasting. Only facial and something will last only for a couple of weeks. These patients come every 3 months or every 6 months, and some patients coming for once a year. And you can see the brightening, lightening effect because laser penetrate deeper dermis. Rest of the procedure come only on the epidermal part. So in short, laser revolutionized the way we are treating in the past. Thank you very much.
Yeah. Thanks, Dr. Sakhia, for enlightening us the non-cosmetic laser benefits. Any questions? Any
question no, Farda.
Okay. So we thought AI will take over, but I think laser is taking over surgeons and plastic surgeons now. So we have to fight, surgeons have to fight AI and lasers both. So I request Dr. Deepak Torawala and Dr. Ashok D. Patel, Dr. Deepak Torawala and Jayendra Kapadia sir to kindly felicitate Sakhia sir. You all are requested to kindly stay post lunch for very special talk, the plenary sessions.
जयेंद्र भाई पहली बाजू कारण के सखिया साहब ने आप हाँ दिस इज द राइट कॉम्बिनेशन ऑफ द लेजर ओके थैंक यू with the permission of the chairman, Dr. Prashant Bhai Desai Senior, as it is now put out like SRK, he is SR. Should we continue? Okay. Now we have Dr.